Being a hairstylist as well as a trichologist is like the best of both worlds. It's kind of in a sense like the doctor and nurse relationship. You have the nurse at the bedside getting a first-hand report on what's going on with that patient. As a hairstylist standing behind the chair, I get a first-hand report on what's going on with the hair and scalp. With trichology, it's like the doctor in a sense. We have to assess what the root cause of that issue may be and come up with a treatment plan to help you manage and treat that issue. So for me, being a hairstylist as well as a trichologist, it's the best of both worlds.
I'm right with you. Okay, well, there's nothing to add. We're going to move right along. All right. What diagnostic test will be done to understand my condition? Okay. So again, it just depending on the symptoms, right? And depending on the symptoms, will depend on like what are the questions and answers I'll pose and then provide, right? To help me assess what the particular hair loss you're experiencing, and like if I need to direct you to like dermatology because you may need a biopsy, you may need some blood work, you may need some culture work, stamp gram staining, things like that. I can provide trichoscopy too, but you may need a follow-up, to get a medical diagnosis on what is actually happening. I can guide you, again, give you some breadcrumbs and say, hey, here are certain questions you should ask the doctor when you go in to see them. Here's how you should say this. Tell them this is what you're experiencing. This is what you feel. To give you that language, to understand how to talk to them. And, too, to make sure that this appointment goes the way you want it to. Because sometimes doctors...
How to advocate.
Right, and advocate for yourself. Because they sometimes, it's like they see so many people, right? They may not even really look at you or touch you.
Sometimes the mind, stays on the health realm side where it's just like, okay, yeah, you're talking about your hair, but we're worried about, but that is a sign. Like that's one of
something's
the first,
wrong within.
Yeah, something's wrong within. Right. So to not allow for the, dismissiveness and just to advocate. And
advocate. Right.
Exactly. So no, that's very important.
Very important.
And a lot of our clients are very appreciative of that, because they say with your hairstylist is where one of the first areas where you are able to notice or to learn that something is actually going on internally and within.
Right.
So.
And what are I had a client come in and she's been going through a journey with pain management, and she's been on this steroid, this immunosuppressant, this, that, and the third. And she's been starting and stopping treatments. And she got on a new treatment. So since the last time I saw her in 2 weeks, she's already on a new treatment. And she came in and we shampooed her, and when I went to put the leave-in on her, she's like, it burned. And I was like, well, I said, I use this on you all the time. This is a new reaction. Are you on any new treatments? And she said, yes, I just started one this week. I said, okay. I said, are you using the treatment as directed? And she paused. And I said, okay. And she said, well, I actually been taking more because I wanted to work. And I was like, no. So I asked her what she was. I looked it up and I said, well, here are the known side effects. And everything she was experiencing, the sensation, the burning sensation, her eyes were red, they were burning, everything was on the list of what she was doing. And I'm like, I believe you're taking too much.
Yeah.
Not so much it's not for you.
Right.
But you're doing it you're incorrectly.
Yes.
So it's not for you to do. You're going to hurt yourself just as what you're doing. Exactly. So
there you go.
Yeah.
See?
Right. The hairstylist.
The hairstylist.
Right. Boy.
Oh, man.
So that was question number 8.
Okay.
All right.